the Cognitive Brain Training Lecture Series, Memory Loss and Memory Formation. We have expert Suresh Kumar M.D., double board certified neurologist and director of Headache, Traumatic Brain Injury, and Cognitive Research Institute. Dr. Kumar has researched and presented this pilot study on individualized cognitive training in national meetings. He has developed Regain Memory 360 treatment, protocol, and approach to patients with memory loss. At present, his patients with memory loss are undergoing online cognitive training in the comfort of their homes with life-integrated, computerized cognitive application. Dr. Kumar, what is the extent of the problem in our community of cognitive loss due to injury or medical disorder?
In young population, according to existing data, more than 1.6 million Americans experience a traumatic brain injury each year. 75% of these patients sustain a mild traumatic brain injury. Thus, each year in United States, almost 1.3 million are treated and released from emergency room. These injuries may cause long-term permanent impairment and disability in 10 to 20% of the individuals. Our study showed only 20 to 22% of the patients with the MTBI were aware of their cognitive disability or impairments. But in elderly population, the memory loss is a silent disease. Up to 5.3 million Americans currently have Alzheimer's disease. By 2020, 20% of the US population is going to be more than 65-year age. By age 85 year, 50% will have a dementia, so almost 30 million will have dementia. By 2040, the number is expected to be double of Alzheimer type dementia. Alzheimer disease is 6th leading cause of death in United States and is the 5th leading cause among persons age 65 and older.
You've been working with patients with cognitive loss due to TBI, CVA, and dementia for the last 6 years. What are the challenges you face as a neurologist?
As an outpatient clinic, we see more subtle to a severe memory loss after acquired or traumatic brain injury. It becomes a challenge as TBI and CVA, which is a stroke with the sudden nature of disability, can lead to frustration, anger, agitation, or depression. Patients' coping skills are further complicated by inability to understand the nature of injury. Example, orbitofrontal cortex injury can cause disinhibition of control. A person can act without thinking about the consequences. Example could be using a poor choice of word to a physical altercation or a silly or no obvious reason. The other extreme is injury to a thalamus or basal ganglia can cause apathy, inactivity, and amotivation, where a person just simply sits on a couch all day, does nothing. Injury to a right parietal lobe of the brain may cause hemi-neglect. Patient is unable to comprehend or realize the weakness of the left side is always a challenge in physical therapy.
You have worked with patients with age-associated dementia. How is this different from brain injury patients?
In contrast, the dementia due to aging or Alzheimer type or vascular dementia is a subtle progression of a disease process with one's inability to realize the loss of cognitive impairment over time. Cognitive impairment is further enhanced by a limited or a physical activity or inactivity and retirement.
How does retirement contribute to dementia, Dr. Kumar?
It is very hard to argue that when our life expectancy was 65, almost 3 decades ago, we used to retire at the age 65, and now our life expectancy is average 75 to 85 years. What should be the retirement age? The early retirement does contribute to a progression of dementia. With the retirement, there is a decrease in cognitive stimulation to our personal world becoming smaller and smaller, less interaction in daily routine. So less cognitive stimulation is a major contributing factor.
Who should be evaluating these patients with dementia?
The medical practice is almost leaned towards taking care of medical disorder in geriatric patients population, but cognitive care is often ignored in early and advanced stages due to we consider a person is simply old. A competent neurologist or MD with a sufficient training and experience in cognitive neuropsychology is the developing field. A complete neurological evaluation and neurocognitive evaluation is an essential part of cognitive management.
How common is psychiatric or other medical disorders in patients with acquired brain injury?
Very important part of the evaluation is identifying any underlying psychiatry or medical disorder preventing the patient with acquired brain injury to learn or form a new memory. For example, underlying sleep apnea can slow or prevent conversion of a short-term memory to a long-term memory and memory retention because of poor attention. Vitamin B12 deficiency or vitamin D deficiency can cause early dementia. Depression causes pseudodementia is well documented. Generalized anxiety disorder can cause decreased attention span and cause memory loss.
You have developed a protocol called Regain Memory 360. Can you tell me some more about this program?
The Regain Memory 360 is a systematic approach to patients with memory loss. A screening questionnaire of underlying psychiatric disorder to a medical disorder like sleep disorder with a simple questionnaire. Lab tests rule out nutritional and other cause of neuronal loss. Electroencephalogram or EEG, one of the common cause of memory loss in young adult individual. The underlying seizure disorder is an abnormal electrical activity in the brain. Once we have ruled out other causes, we give standardized neurocognitive tests. Once we have the results, we start working on our cognitive deficiencies. We have very strict selection criteria to offer for a synchronized repetitive transcranial magnetic stimulation. It is a systematically proven to stimulate brain neuron or rejuvenate the neuron in brain cells.
How is Regain Memory 360 program different from all the other programs like online gaming sites for memory enhancements that are out there right now?
Well, we were talking about we have a systematic approach to the patients. Once we know the brain has an ideal neurochemical balance to learn, we start training the brain. LICA, Life Integrated Computerized Cognitive Application, is a very robust online brain training program, can activate individual cognitive domain and circuit. We have found after research has ability to customize for individuals. We have ability to bring the patient's life into the program to stimulate the daily working memory. The other online program only challenges your visual motor circuit and you develop good reflex arc to the stimuli. Give an example. My 11-year-old son did better than me on online brain training gaming sites. His skills were more evolved with the video games. He does not have disinhibition or inhibition to click on the things appear on the screen. But I have analyzed, think, and click with the old generation. We analyze, we respond differently to the computers.
Tell me a little more about transcranial magnetic stimulation.
Magnetic stimulation has been tried in many disease processes last 2 decades. It has found its place in muscle stimulation in physical therapy, treatment and prevention of migraine headaches. It has been FDA approved. By inhibiting or spreading the impulse in a neuron, TMS has become approved treatment of depression. Repetitive synchronized transcranial magnetic stimulation helps to stimulate or rejuvenate neuron. We offer 5 days of 90 minutes stimulation of neuron cells, but only stimulation does not help the cognition. It is the same as you watched a very interesting movie and your brain cell has been stimulated. Start thinking with the continuous 90 minutes of audio-visual stimulation. Then you go back to your daily routine life. After brain stimulation, we also start working on cognitive domain found impaired on a cognitive testing.
Can you tell me how an individual creates a memory?
Memory is the building block of intelligence learned in past and present through a higher sense of a visual, auditory, tactile, and touch stimulation. Memory is further divided into a short-term memory and long-term memory. Short-term memory is converted into a long-term memory with repetitive stimulation. Short-term memory is more important. If you do not form short-term memory, it will not be translated into a long-term memory. Short-term memory is created by acoustic repetition, visual association, emotional association, as well as through a rhyme and music. Logical association also contribute in short-term memory. Example, we used mnemonic to create logic or rhyme to remember our medical school terminology every day without knowing the mechanism of memory. To better understand a long-term memory, we have seen billions of dollars has been spent on advertisement in movie to game channels about all kind of products, sometime some attractive model and sometime associated with the coupon or rebates. So, attractive model is a simple way to get your attention. Once they have your attention, it is about the feature of the product, and this process repeats over times. Now, it has created a long-term memory. When you walk down to the store, you subconsciously or for curiosity look for the same product. Now, question is, how did you remember it? Simple repetitive stimulation makes the changes in your brain neuron protein structure, encoding, and once it's consolidated, this can be further broken down in small pieces of a visual image, name, sound, rhyme associated with it, and stored in a different association area or shelves of the brain. Once the stimulus comes in form of the visual, auditory, word, it pulls all the information stored from different shelves, and you have all the detail of the product. I always tell my medical students or patients taking test, the best stimulus for the memory is the question. You have already read the answer about it.
What is forgetfulness?
I consider forgetfulness is the beauty of mind. Forgetfulness is the loss of balance of a memory formation and memory loss. The memory system has an inbuilt ability to prioritize the memory creation according to attention, interest, and your need. Rest of the information is continuously filtered and is called memory attrition. Accelerated memory attrition is a forgetfulness when the filtering system is out of control.
Thank you, Dr. Kumar, for giving us such a comprehensive outline of memory loss and the formation of memory. This concludes the first part, memory loss and memory formation. Please watch the second video about the coping skills with cognitive loss.
Thank you.